Hi, I'm Dr. Nate Adi. I'm here to talk to you guys today about children's vision and the InfantSEE program. One question I get a lot from parents is when should I bring my children in? And we recommend between 6 months to a year for their first full eye exam. And when I say that, a lot of times I get the question, how can you do an eye exam on an infant? So I want to show you a little bit of an exam. It's not the full thing what we do, but it will give you a pretty good idea of all the different things we can do on an infant. We're going to start this eye exam on Ryan today. Today we're going to do everything both eyes open. When we're in a normal InfantSEE eye exam, we'll cover up one eye at a time. We can use a sticky patch. We want to make sure each eye sees really well. And sometimes just the act of covering one eye up or the other eye up, and if they get squirmy with one eye but not the other, that clues us into something might be going on with one eye. So just like with an adult, we'll check acuity to start, see how well we can see, just like this letter E up here. In order to tell that that's an E, we have to see the bar and the space and the bar and the space and the bar. We can do a very similar thing with these paddles, so we can make sure that we see the bar and the space and the bar and the space, and we make them smaller and smaller until we can't tell the difference between this pattern and just a plain gray background. And we take advantage of the kiddos' reflex of liking to look at a pattern better than a gray background. So when we show them, hey Ryan, looky here, you'll notice that he looked right here at the pattern instead of the gray background. And so we'll do that one eye at a time, go smaller and smaller on the grading there. The other thing that we can do is make sure that they can fixate on a target, yeah, with each eye. Where's my lion at? There he is. There he is, yeah, very good. Oh, where's my lion at? Good. So it doesn't like that eye covered up quite as much, but that's pretty normal there. So what do you see here? And we'll play peekaboo with them here. Where is that? Yep, make sure that the eyes line up nice and straight. Hey buddy, there he is, very good. And we'll see if he can follow him up to his nose. Oh, yeah. Always maker for this guy. Up here, yeah. Good. And make sure that their eye muscles move in all the directions that we want them to. Very good. So, and sometimes if we have difficulty with that, we'll turn the lights down. And as you can see here, there's going to be a reflex right in his pupils there. And I can make sure, oh, that's a little bright, wasn't it? I can make sure that his eyes line up nice and straight that way as well too. So if you've been to the pediatrician, you may remember seeing them shine a light in their eyes. So we're checking to make sure that we can see an equal reflex between the eyes here, that there's nothing standing out different. And then we can also check their side vision, make sure that they're aware of everything going on in their surroundings there. So I'll get his attention here, and then we'll see, yep, we're gonna check those side reflexes as well. Get his attention here. Very good. And we'll of course do that one eye at a time in a typical InfantSEE exam. So at this point now we would add some eye drops. At kiddos this age, they really don't have any problems getting the eye drops in their eyes. What it does is it relaxes their focusing system. They can focus really, really strong, and it opens up their pupils for us to look in the back of the eye there. So once we've put those drops in, we've got two more things that we would do. The first thing that we would do is, again, what is that? What is that? We would turn the lights down low here, and I'm just going to shine this light right at him here, and I can look at the reflex that comes back from his eyes. There we go, yeah. And I can tell if we're far-sighted, if we're nearsighted, if we have astigmatism, and most importantly, if we've got a big imbalance between the eyes. So we expect some prescription at this age, but if there's a big imbalance, that can cause some problems developmentally, so that's what we're really looking for at this point. And then finally, we can check their eye health with this headpiece and magnifying glass, so we get their attention. These light up toys are magic for infant exams and kiddos alike. There we go, he's doing perfect. We can get a really good view. What is that? There it is. There we go. a good view of the back of their eyes, check their optic nerve, all the blood vessels, make sure the retina is nice and healthy and developing the way it should. And so that's most of an InfantSEE eye exam. There would be a little bit more that we would do on an actual patient, but Ryan did a good job of showing us pretty much everything that you guys need to know about an InfantSEE exam. So as you can see, it didn't take very long, only maybe 5 minutes to get through most of that testing. There's about a 20-minute delay there with the eye drops before we can finish up, but you can go up front and in that meantime, if the child falls asleep, that's actually fine and preferred. So, so again, the first time we recommend a child to be seen between 6 months to a year. If everything's good at that exam, we typically recommend 3 years of age, and then around the age of 5, right before they start kindergarten, and yearly from that point once they start school. And remember, the vision screenings at school do not replace a comprehensive eye exam. If you have any more questions, you can always Google search the InfantSEE program to find a provider near you, or feel free to reach out to me on Facebook on our Dr. Nate Optometrist page. Thanks.